There are fewer than we would like women CEOs in organizations and fewer senior leaders who are women in organizations. We're finding from the non-healthcare ranks that companies who have good representation on both boards and in senior leadership have better operating results. So that's what we'd like to see. Healthcare is actually behind the rest of general industry. It lags a little bit, probably due to the fact that it just hasn't been a focus, and we've had many leaders who have been in traditional roles for a very long time. I think in the main, because so many women in healthcare have been clinical, and the male counterparts have been the business people. They've come up through the CFO ranks and through the operating ranks, where women have risen to chief nursing officers but haven't quite made it through the glass ceiling to be in the C-suite. I think in general it would create a much greater opportunity for collaboration and really breaking down silos in healthcare. Women tend to be more patient-centered and are more inclusive in their decision making. So I think at a time when we are faced with change, and that's the other thing that I think women are spectacular at, is they're natural communicators and nurturers. So they'll be very helpful in taking organizations through very complex change management times. We got started in a very simple way. I had a CEO, male CEO by the way, who noticed that I was the only woman in senior leadership and asked me to fix it. And so we went about a short process of understanding that most other evolved industries had already addressed this through women's affinity groups. And we turned it over to a very active and efficient group of women in our organization who created the powerful group that is the Women's Leadership Alliance at Piedmont today.
It is a structured organization within the company. It has its own set of bylaws. It has its own elected officers. It has its own programming that's done annually. It has targets that they're set to achieve annually. They also have a budget that we were given to support the efforts of the program. So in launching it, the first year was building the infrastructure. We spend about 50% of our time in leadership development areas. We focused on the core competencies of future leaders. We also survey our membership annually to see where they feel like they could use some programming. So far, we've been able to demonstrate that we have a higher percentage of women moving into management positions. We have a higher retention rate with our membership than non-members of the organization. What we've not been able to do is really change the ratio of male-females at the most senior levels of our organization. That has remained static. It's one of two things, or maybe both. It's either we need more time, it takes a while to change, or we need a different approach. And I think we've really got to dig deep and figure out which one of those it might be. Well, we'll continue to market it and grow it. It's only 13% of our total female population, so we've not really scratched the surface. I would also say that we need to figure out new strategies to get more of our nurse leaders engaged. When you look at the ratio of our membership, they're mostly the business exempt employees. We've had a real tough time getting the nurses, who I think have tremendous potential, particularly as healthcare is moving towards a more service and quality and value-based model. We have to engage them in the leadership of the future. Sure.
When we set it up, we did it with that intent. We made it very formal from a bylaw perspective and organizational expectations so that others could follow, but they would all be based on a solid business premise with clear metrics and outcomes associated with them. But it's there for the taking for any other group that would like to join, to develop a special interest group within Piedmont.